name is Jacqueline Bryan. I'm the Public Relations Officer with the National Emergency Management Agency, affectionately called Nema, right here in St. Kitts and Nevis, where the 13th Caribbean Conference on Comprehensive Disaster Management, it's a mouthful, is being hosted for the first time in an OECS member state. It's called CDM13 for short. And Nema decided to speak with some key players who are participating in the conference. The persons we're going to be interviewing are persons who have done research and presented their findings at the conference, or were panelists in some of the very important discussions taking place here. And we are very happy with all the persons who agreed to sit with us and give us an overview of their findings or their thoughts and the discussions that they've had on very critical issues where disaster management and resilience is concerned. And today we have with us two very important people, and very important because they're not just here participating in the conference, but they actually have a long-standing relationship with Nema. I am joined by Dr. Audrey Snyder. She is Professor and Associate Dean for Community Engagement and Academic Partnerships with the University of North Carolina, Greensboro. Did I say that right? Greensboro?
Yes.
Dr. Snyder. And we also have Tammy Hall, who is Assistant Professor for Professional Track at the University of North Carolina, Greensboro. Thank you so much for agreeing to sit here and have a discussion with me. You presented some research findings in a session that was held. It was like a side event, and it was well attended. I was happy to see so many persons in the room. But your relationship with St. Kitts and Nevis and Nema goes back several years. So tell us about that first.
So our relationship with St. Kitts and Nevis goes back to 2007 when we had a visit from the Minister of Health, Rupert Herbert, who came to the University of Virginia, where I was faculty at the time. And he met with Dr. Marcus Martin, who was our Director of Emergency Medicine, and I was a nurse practitioner in our emergency department at the time, as well as a faculty member. And we developed a study abroad program that focused on disaster preparedness. And with this, we utilized the islands of St. Kitts and Nevis as a microcosm for students from the U.S. to study the impact of disasters and to begin to look at the disaster cycle and what individuals could do to impact that. So over the years, we have brought many students to St. Kitts and Nevis, usually in the January break between semesters or in the summer, staying at least 2 weeks to be able to study, to learn from the experts who are here on the islands that work with Nema and NDMD, and to also provide continuing education for some of the physicians and nurses, and to conduct research that is important to the islands. Both departments have a small manpower, and when we come, we bring a group of students who are enthusiastic and eager to interact with persons who live on the islands, to learn more about the culture, and to be of service in some way. So we allow the local agencies, Ministry of Health, to guide the work that we do, and then we implement projects, whether that is research or education, and then present that back and evaluate it with the local personnel from Nema and NDMD.
And for those who don't know, NDMD stands for Nevis Disaster Management Department. So that would be our sister organization in Nevis. I had the great fortune of meeting you for the first time this year, amazing group, and learning more about the work that you do while here. Can you elaborate on that for persons who are going to be watching this interview?
Sure. This year, we came to the islands with a group of students from the University of North Carolina, Greensboro, and a group of students from Utah Valley University. And our focus this year was research. And with this, I will hand the microphone to Mrs. Hall to talk a little bit about her work as a doctoral student doing directed research here on the islands.
When we came to the islands, we wanted to know what factors are involved in the residents of St. Kitts and Nevis being prepared for a disaster, and then being resilient if they should experience a disaster. So we wanted to see what they were doing to prepare, what they were doing to prepare to be resilient, and then what were the factors that are associated with them actually being prepared.
So there was a survey we sent out. I think you said this was the first time you did electronically.
Yes.
Yes. So many persons might have gotten a link from Nema or NDMD asking you to fill this information out. It's from the University of North Carolina. We're assisting them with this survey. And this is why it's important for you to have filled it out. We want to thank the persons who completed the surveys and participated and contributed to their findings. So tell us about why this survey was so important and some of the challenges you faced when you did it this time around.
The original survey was done back in 2018. And at that point, students went to the different districts and parishes and used paper surveys to gather information from the residents. This time we did do it completely electronically, and we had a little bit of a challenge to engage the residents to use the electronic survey. And so that was our biggest challenge, was that it wasn't on paper. It wasn't easy to just hand it over or help somebody answer that on a piece of paper. And so I would say that was our biggest challenge, was transitioning to the entirely electronic version of the survey. But this time, so in the original one, we had about 398 participants. This time, we had 198 participants. And we had to, actually 320 answered, but didn't complete the survey. They answered maybe the first 5 questions and then left the rest of the questions blank.
So the next time we need to complete those surveys.
Yes.
Yes.
Yes, all the way to the end.
All the way to the end.
Because that helps us so much in knowing what the community members are thinking about their preparedness. And do they have a plan? And what is their next step in being prepared? And so that's so helpful when we get all of the information from the residents. It gives us such insight into what they are thinking, and then how we can help or suggest interventions or suggest ways to remedy any challenges that they have.
And you actually share this information with Nema and NDMD, so it helps to guide us to know what needs to be done, how we can assist people further to make sure that everybody is more prepared and can be more resilient. So all the way to the end next time, guys.
All the way to the end.
So tell us about some of the findings. I know you haven't really shared it with all the stakeholders you want to yet.
Right.
You were able to present an overview of your findings at CDM13 at a side event. You got a lot of questions. I know people came up to speak with you afterward. They were quite interested in the work you were doing. So whatever you can tell us about your findings, please share.
Well, the number one thing that impressed me the very most was that the residents of St. Kitts and Nevis count on Nema and NDMD for their information on disasters and how they can be prepared, and they look to you for direction. And that was so meaningful to me to see those results.
It's meaningful to me too. I'm happy to know that. Yes.
You do. So that was so wonderful to see that. And the other aspect was that people are very interested in CERT, the Community Emergency Response Training. They were very interested in that, and they knew the importance of CERT training. When we looked at the results, there were fewer CERT-trained residents in 2024 than in 2018. But everyone that we spoke with seemed to know how important CERT training was. And so one of the recommendations that we had then was, we know that people are coming out of COVID, that many people became weary of information and training after COVID. But it looks like from the findings that now would be a great time to step up those CERT trainings and get more people involved in those so that they can help out the people in their parishes, in their districts. Another finding that we had was that in every district and parish, people felt like their neighbors would reach out and help them
That's fantastic.
during a disaster.
That's fantastic.
And so, we feel that when we're here. We feel the unity of the people in St. Kitts and Nevis. But it was so neat to see it actually on paper that the community can depend upon one another. And that warms my heart to think, if there should be a disaster, that the community will reach out and help one another. We had we talked about having fewer people being a part of the interviews this time and taking the surveys. And we think that COVID had something to do with it, that people are tired. But the other thing is that COVID was the last disaster that St. Kitts and Nevis experienced. And so there hasn't been anything to spur them to become more prepared. And so soon after we collected these surveys is when Beryl came through. And we would have loved to have been able to do the surveys again after Beryl to see if, having experienced Beryl, people were more aware of their need to be prepared for disaster.
Well, thank you so much for sharing all of that insight with us. Very important work that you're doing here. And research findings like that can go a very long way. I know we are expecting you back next year. Will you be conducting another research next year? Do you already know what your focus is?
So it has been mentioned to us that looking at a focus on the impact of climate change could be an important topic, but we will continue those conversations with the leadership and make a decision in the next couple of months so that we can be prepared to come back and help with what those in leadership on the islands feel that they need assistance with.
Fantastic. Well, thank you so much. I know you're going to be leaving shortly. I want to wish you a very safe journey home, and we will be counting down the days to your return. We know you do a lot of good work while you're here, and we really appreciate the partnership. So I really just want to say thank you. Thank you so much for all that you've done. And I know that the last time you were here, you also made a contribution. You made a donation to Nema. So while you're in the United States, you were also trying to procure items that you could bring to St. Kitts that could help. So you're helping in so many different ways. You conducted a training session. Was it a Stop the Bleed training session? So there's a lot of things that you do while here in addition to your research. And we really appreciate it. Thank you. So that was Dr. Audrey Snyder, Professor and Associate Dean for Community Engagement and Academic Partnerships, and Tammy Hall, Assistant Professor for Professional Track, both from the University of North Carolina, Greensboro. And I am Jacqueline Bryan, Public Relations Officer at Nema, and this was Nema Table Talks from CDM13.